Labetalol. Expanded lecture notes. Labetalol is a medication that treats high blood pressure, hypertension. It works by blocking alpha and beta receptors in the body. Labetalol is particularly useful in emergencies for rapid blood pressure control. It's also useful in pregnancy-related hypertension due to its effectiveness and safety. Understanding labetalol's mechanism, uses, and considerations helps manage hypertension in various clinical settings. Objectives on labetalol. By the end of this presentation, participants should be able to 1. Define labetalol and its clinical importance. 2. Explain the history, classification, and properties of labetalol. 3. Describe its mechanism of action, pharmacokinetics, and pharmacodynamics. 4. Discuss its clinical uses in anesthesia, ICU, and emergencies. 5. Identify its side effects, contraindications, and precautions. 6. Compare labetalol with other antihypertensives. 7. Understand current research trends and patient education. Labetalol. Other names. 1. Generic name, labetalol. This is the non-proprietary name of the medication. 2. Trade names, Trandit, Normadine. These are brand names under which labetalol is marketed. 3. Chemical name. 2-hydroxy-1-hydroxy-2, 1-methyl-3-phenylpropyl amino ethyl benzamide. This describes the chemical structure of labetalol. Introduction. 1. First synthesized in the 1960s as a unique combined alpha and beta adrenergic blocker. Labetalol was developed to block both alpha and beta adrenergic receptors. 2. Widely used for hypertensive emergencies, perioperative hypertension, and pregnancy-induced hypertension. Labetalol is a common choice for managing high blood pressure in these situations. 3. Research shows it has a better safety profile than pure beta blockers in certain conditions due to additional alpha blockade leading to less reflex tachycardia. Dual blockade helps minimize some side effects seen with beta blockers alone. The myths. 1. Myth. Labetalol is unsafe in pregnancy. Truth. It is one of the preferred antihypertensives in preeclampsia. 2. Myth. Labetalol causes complete heart block in all patients. Truth. Only in patients with underlying conduction defects. 3. Myth. All beta blockers worsen asthma. Truth. Labetalol is less likely but still contraindicated in severe bronchospasm. Definition. Labetalol is a non-selective beta-adrenergic blocker with selective alpha-1 blocking activity, used primarily for the management of hypertension and hypertensive crises. This means labetalol blocks beta receptors, beta-1 and beta-2, and alpha-1 receptors, helping to lower blood pressure by reducing vascular resistance and heart workload. History. 1. Developed by Allen and Hanberries Limited, UK, in the late 1960s. Labetalol was created as a combined alpha and beta blocker. 2. Introduced clinically in 1977. Labetalol started being used in medical practice around the time. 3. Gained FDA approval in the US in 1984. Approval allowed labetalol to be marketed and used in the United States. Classification. 1. Pharmacologic class. Mixed adrenergic antagonist. Labetalol blocks both alpha and beta adrenergic receptors. 2. Therapeutic class. Antihypertensive, antianginal. Labetalol is used to treat high blood pressure and can help angina due to its effects on the heart and blood vessels. Chemical properties. 1. Molecular formula. C19H24N2O3. This describes the chemical makeup of labetalol. 2. Molecular weight. Approximately 328 grams per mole. This is the approximate weight of a labetalol molecule. 3. Chiral centers leading to exists as 4 stereoisomers, only 2 are pharmacologically active. Labetalol's structure allows for different forms, but only some of these forms have therapeutic effects. Physical properties. 1. White crystalline powder. Labetalol appears as a solid powder. 2. Water-soluble. Labetalol dissolves in water. 3. pKa 9.4 weak base. This indicates labetalol's ionization properties. 4. Stable in acidic solutions, light sensitive. Labetalol's stability depends on conditions like pH and light exposure. Mechanism of action of labetalol. 1. Beta blockade. Beta 1 plus beta 2 decreases heart rate, cardiac output, and renin release. This helps lower blood pressure and reduce heart workload. 2. Alpha 1 blockade causes vasodilation, leading to decreased peripheral vascular resistance. This contributes to lowering blood pressure. 3. Combined effect results in decreased blood pressure without typically causing reflex tachycardia due to the dual blockade of alpha and beta receptors. Pharmacokinetics. 1. Absorption. Oral bioavailability approximately 25%, first pass effect. Labetalol is partially metabolized before reaching circulation when taken orally. 2. Onset. IV 2 to 5 minutes, oral 20 to 120 minutes. Time to start working depends on administration route. 3. Peak effect. IV 5 to 15 minutes. Maximum effect occurs shortly after IV administration. 4. Duration. 2 to 6 hours. Effects of labetalol last a few hours. 5. Metabolism. Hepatic glucuronidation. Labetalol is broken down in the liver. 6. Excretion. Renal, urine, and feces. Labetalol is removed from the body via urine and feces. 7. Half-life. 5 to 8 hours. This is how long it takes for labetalol levels to reduce by half in the body. Pharmacodynamics. 1. Blood pressure via combined mechanisms. Labetalol lowers blood pressure through alpha and beta blockade effects. 2. Preserves cerebral, renal, and coronary blood flow. Labetalol's effects help maintain blood flow to vital organs. 3. Dose-dependent response. Higher doses equals more profound hypotension. Increasing labetalol dose leads to greater blood pressure reduction. Storage and disposal. 1. Store at 20 to 25 degrees Celsius, protected from light. Labetalol should be kept at room temperature and away from light. 2. Do not freeze IV solutions. IV preparations of labetalol shouldn't be frozen. 3. Discard unused solutions safely as per hospital guidelines. Unused labetalol should be disposed of following hospital protocols. Drug interactions. 1. Additive hypotension. With nitrates, anesthetics, calcium channel blockers. Using labetalol with these drugs can lower blood pressure more. 2. Exaggerated bradycardia. With digoxin, amiodarone. Combining labetalol with these can slow heart rate more. 3. Masks hypoglycemia. In diabetic patients on insulin. Labetalol can hide symptoms of low blood sugar. 4. Enhanced effects. With MAO inhibitors. Using labetalol with MAO inhibitors can increase labetalol's effects. Clinical uses. 1. Hypertension, chronic and acute. Labetalol treats high blood pressure in various settings. 2. Hypertensive emergencies. Labetalol is used for rapid blood pressure control in emergencies. 3. Pregnancy-induced hypertension, preeclampsia, eclampsia. Labetalol is a choice for managing high blood pressure in pregnancy. 4. Perioperative BP control. Labetalol helps manage blood pressure during surgery. 5. Angina, aortic dissection. Labetalol can be used in these cardiovascular conditions due to its effects on blood pressure and heart workload. Use in ICU. 1. Rapid BP control in critically ill patients. Labetalol helps quickly lower blood pressure in ICU settings. 2. Management of hypertensive encephalopathy. Labetalol is useful in treating high blood pressure affecting the brain. 3. Safe for patients with renal impairment. Labetalol can be used in patients with kidney issues. Use in anesthesia. 1. Control of intraoperative and postoperative hypertension. Labetalol helps manage high blood pressure during and after surgery. 2. Smooth induction in high-risk cardiac patients. Labetalol's effects help in managing cardiac patients during anesthesia. 3. Attenuates pressor response to laryngoscopy and intubation. Labetalol reduces the blood pressure spike caused by these procedures. Use in emergencies. 1. First line in hypertensive crisis. Labetalol is often used to quickly lower very high blood pressure. 2. Aortic dissection with IV infusion. Labetalol helps manage blood pressure in this serious condition. 3. Eclampsia. Labetalol is used to control high blood pressure in pregnant women with eclampsia. Nursing management. 1. Monitor BP, HR closely, continuous if IV. Check blood pressure and heart rate frequently, especially with IV labetalol. 2. Watch for orthostatic hypotension. Patients may get dizzy when standing up. 3. Educate patients on slow position changes. Patients should move slowly to avoid dizziness. 4. Record intake, output, renal perfusion. Monitoring helps assess kidney function while on labetalol. Administration and dosage. 1. Oral, 100 to 400 mg twice daily, max 2,400 mg per day. Typical oral dose range for managing hypertension. 2. IV bolus, 20 mg over 2 minutes, may repeat or increase dose, 40–80 mg every 10 minutes. IV bolus for rapid blood pressure control. 3. IV infusion, 0.5–2 mg per minute until desired BP. Continuous infusion for controlled blood pressure reduction. Side effects. 1. Dizziness, fatigue, nausea. Common side effects patients may experience. 2. Orthostatic hypotension. Low blood pressure when standing can cause dizziness. 3. Bradycardia. Labetalol can slow the heart rate. 4. Mild edema. Some patients may experience slight swelling. Serious side effects. 1. Heart block. Labetalol can affect heart conduction in severe cases. 2. Severe bronchospasm. Labetalol may cause breathing issues in susceptible patients. 3. Hepatic dysfunction, rare hepatotoxicity. Labetalol can rarely cause liver problems. 4. Hypotensive shock. Severe low blood pressure is a potential serious side effect. Contraindications. 1. Asthma, COPD. Labetalol can worsen breathing issues in these patients. 2. Severe bradycardia, AV block. Labetalol isn't suitable for patients with certain heart conduction issues. 3. Cardiogenic shock, heart failure. Labetalol may worsen these conditions. 4. Hypersensitivity. Labetalol shouldn't be used in patients allergic to it. Precautions. 1. Diabetics masking hypoglycemia. Labetalol can hide low blood sugar symptoms. 2. Elderly, sensitive to hypotension. Older patients may be more affected by low blood pressure. 3. Pregnancy, safe, but monitor fetus. Labetalol can be used in pregnancy with fetal monitoring. 4. Liver disease. Labetalol is metabolized in the liver. Caution in liver issues. Advantages. 1. Dual alpha and beta blockade. Labetalol blocks both alpha and beta receptors for blood pressure control. 2. Fewer reflex tachycardia effects. Labetalol's dual action minimizes heart rate increases. 3. Safe in pregnancy. Labetalol is used for hypertension in pregnant women. 4. Multiple routes, IV, oral. Labetalol can be given intravenously or orally. Disadvantages. 1. Poor oral bioavailability. Labetalol has limited absorption when taken orally due to first-pass effect. 2. May cause hepatotoxicity, rare. Labetalol can rarely cause liver damage. 3. Contraindicated in asthma, COPD. Labetalol isn't suitable for patients with these breathing conditions. Clinical considerations. 1. Preferred in hypertensive emergencies. Labetalol is often used for rapid blood pressure control in emergencies. 2. Dose titration essential. Adjusting labetalol dose is important for effective and safe use. 3. Monitor closely perioperative use. Careful monitoring is needed when labetalol is used during or after surgery. Labetalol and comparisons with other agents. Features: drug class comparisons. 1. Labetalol alpha plus beta blocker. Onset 2-5 minutes IV duration 2 to 4 hours. HR effect: minimal reflex tachycardia. Colorado effect: mild, stable to slight decrease. Pregnancy use. Safe. Drug of choice. 2. Hydralazine arterial vasodilator. Onset 10 to 20 minute. Duration 2 to 6 hours. HR effect: reflex tachycardia. Pregnancy use. Safe, but reflex tachycardia can be limiting. 3. Esmolol short-acting beta-1 blocker. Onset 1-2 minutes. Duration 10 to 20 minute. HR effect: strong decrease in heart rate. Colorado effect: non-significant. Pregnancy use. Not preferred. 4. Nicardipine calcium channel blocker. Onset 2-5 minutes. Duration 4 to 6 hours. HR effect: reflex increase in heart rate. Colorado effect: moderate, stable increase. Pregnancy use. Limited data. Additional information. 1. WHO and ACOG recommend labetalol for preeclampsia. Labetalol is a recommended treatment for hypertension in pregnancy. 2. Included in essential medicines list. Labetalol is considered an important medication by WHO. Current trends and research on labetalol. 1. Investigated in stroke-related hypertension. Research is exploring labetalol's potential use in managing hypertension related to stroke. 2. Role in sepsis-associated hypertension. Current research doesn't specify a significant focus on labetalol's role in sepsis-associated hypertension based on available data. 3. Newer studies. Safety in renal transplant anesthesia. Studies like those on continuous intravenous labetalol for blood pressure control in neurosurgical patients suggest labetalol's potential as a promising option for blood pressure management in critical settings, though specific research on renal transplant anesthesia isn't highlighted in the search results. Labetalol is a medication used primarily for treating hypertension, and research continues on its applications and safety in various clinical scenarios. Patient education. 1. Do not stop abruptly, risk of rebound hypertension. Stopping labetalol suddenly can cause blood pressure to spike. 2. Report dizziness or slow heartbeat. Patients should tell their doctor if they experience these side effects. 3. Take medication consistently. Labetalol works best when taken regularly as prescribed. Conclusion on labetalol. 1. Labetalol is a versatile antihypertensive with combined alpha and beta blocking properties. This dual action helps control blood pressure. 2. Making it effective, safe, and essential in anesthesia, ICU, and emergency. Labetalol's properties suit it for use in various critical care settings. Take-home tips. 1. First line in hypertensive emergencies. Labetalol is often used for rapid blood pressure control in emergencies. 2. Preferred drug in preeclampsia, eclampsia. Labetalol is a recommended treatment for hypertension in pregnancy with these conditions. 3. Avoid in asthma, severe bradycardia, and heart block. Labetalol isn't suitable for patients with these conditions due to potential worsening of symptoms. 4. Monitor BP and HR continuously during IV use. Close monitoring is needed when labetalol is given intravenously. Professional quote. Labetalol is not just a drug to lower pressure, it is a bridge between safety and stability in critical care. This quote highlights labetalol's role in managing hypertension in critical situations like hypertensive emergencies, anesthesia, and ICU settings, where balancing blood pressure control with patient safety is crucial. Thank you for watching. If you liked this content, don't forget to like to show your support. Comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.